I'm Dr. Pierluigi Porcu. I'm a medical oncologist and a lymphoma researcher at Thomas Jefferson University in Philadelphia at the Sidney Kimmel Comprehensive Cancer Center. I'm here at ASH this year to present data from a clinical trial in cutaneous T-cell lymphoma called Tellomak. And cutaneous T-cell lymphoma, it's a group of rare lymphomas that affect primarily the skin. So these are non-Hodgkin lymphomas, so-called extranodal, that affect the skin. And they are originated from a type of cell of the immune system called T-cell. They're rare diseases, so they tend to affect only about 2,000 to 2,500 new patients per year. But the prevalence is high because these patients, on average, have a fairly long survival, and therefore, at any given time, the overall annual prevalence of this disease is in the tens of thousands. And one of the most important things to know is that most of these patients, for the course of their lives, actually require treatment, off and on. So it's kind of a lifelong sort of approach to treatment, both in terms of skin management as well as sometimes systemic management. Being on the skin, this is a very visible disease, as you can imagine. So kind of the management and the presentation of this type of lymphoma presents challenges and aspects that are unique compared to a lot of other lymphomas that affect, the internal organs and the lymph nodes. Anybody, kind of can see a rash. And so there's a kind of a social component of this disease as well, which is very important in affecting quality of life. Regardless of the stage of presentation and the overall prognosis that people have, and there are patients who have a fairly good prognosis when they present in early stage, as opposed to patients with advanced stage or refractory disease that have a worse prognosis. But regardless of whether they have high stage or low stage, almost everybody has issues about quality of life and symptom management. These can be something that are primarily related to the skin. For the most part, such as itch is one of the most important ones, but also redness of the skin, issues of self-esteem and rashes on visible parts of the body that actually complicate the social life. And then there are some more serious symptoms, for example, actually a loss of heat, for example, a loss of fluids through the skin, desquamation of the skin, sometimes hair loss and all of that. So it's a multitude of symptoms. And those symptoms, considering that the patients very often need to go on treatment off and on for their whole life, these symptoms are a constant battle for patients to fight with. One of the important things to understand is that even though there are a number of good approaches for managing the symptoms in the skin, such as moisturizing and lotions and all of that. Ultimately, though, the improvement in the symptoms and the improvement in quality of life is really directly dependent on treatments that actually have efficacy against the tumor, the cancer itself, right? So the best way to control the symptoms, especially to a great degree, is to have treatments that are very effective for the CTCL itself. And this has been a challenge because most of the treatments available so far, even though we've seen improvement in the efficacy of these treatments, but no treatment is a cure, unfortunately, to this day. And many of the treatments, even though they are available and we use them all the time, but they don't really lead to complete responses. Or if they lead to complete responses, these responses are short-lived. So it's a constant sort of struggle to kind of move from one treatment to the next, and therefore the availability of different treatments is extremely important. That's where Tellomak trial comes in, because Tellomak, it's a large international phase 2 multi-cohort study that evaluates a drug called Lacutamab. Lacutamab is a monoclonal antibody, so this is a form of immunotherapy. It's a monoclonal antibody targeting an antigen called the KIR3DL2, which is highly expressed on the tumor cells of CTCL. And Lacutamab enrolls essentially Tellomak enrolls patients that have both Sézary syndrome, which is a rare, very aggressive type of CTCL, and mycosis fungoides, which is a more common type of CTCL. Sézary is aggressive because generally presents with more advanced stage. It affects the blood, and symptomatically it causes redness and scaliness and itching throughout the whole skin. Whereas mycosis fungoides, even though there is quite a bit of itch as well, but it seems to be a little more localized to the spots where the mycosis fungoides is affecting the skin. So Sézary syndrome had a specific dedicated cohort in Tellomak with the intent of addressing this very high unmet need in Sézary syndrome. And then there was a larger cohort of patients, about 107 patients with mycosis fungoides, that were broken down in different cohorts depending on the level of expression of KIR3DL2. So the trial is complete accrual now, and the efficacy and the safety data were presented for Sézary syndrome at ASH last year, and for mycosis fungoides were presented at ASCO this year. So here in San Diego this year, we presented on Sunday the quality of life data, which is a very valuable and high interest data set for this treatment. And what we observed, first of all, we use two different tools to assess quality of life. One is called the visual analog scale, which is a 10-point scale that measures the intensity of itching, with 0 being kind of a no itch, and with 10 being the worst possible itch. To measure global quality of life, a more composite assessment of quality of life, we use a questionnaire that is called the Skindex-29. This is a validated questionnaire that's been used in multiple skin disorders, including CTCL, has been used in many CTCL studies before. And the Skindex-29 is composite, so in other words, measures quality of life across 3 different domains. And one of them is symptoms, while the other one is emotional, and the other one is functional. And so people were asked to compile and complete the questionnaire, saying over the previous 4 weeks how many of the symptoms listed in the 3 different domains actually they had, and score them. And then the composite median analysis of all of that was reported as a single score. The score can be, max to 100. And generally scores above 40, 41, 42 are considered severe. So using those 2 scales, which by the way were completed to a very high level, they had a very high level of completion. More than 80% of the questionnaires were completed. We have the data set is very, very good for the quality of life. This is important for patient-reported outcomes, where sometimes the quality of the completion of the surveys may not be sufficiently good. This was very, very good. And what we noted was that at baseline, the vast majority of the patients actually scored their pruritus, so their itch, as severe, and the quality of life scores were severe to very severe with the Skindex-29. On treatment with Lacutamab, starting from week 5, the severity of those scores came down substantially for both Sézary syndrome and mycosis fungoides. So that, then going on to, week 8, week 16, 40, and all the way to week 81, the scores came down significantly. And then the vast majority of the patients had actually low intensity quality of life scores, so revealing a very substantial improvement. Importantly, these improvements were observed not just both CTCL and Sézary syndrome, which is already remarkable, but particularly for mycosis fungoides, because it's been more challenging to actually document and prove improvement in quality of life in mycosis fungoides. But they were also observed in patients who did not achieve an objective response. So you have the complete response and partial responses. They had improvements in quality of life, but we also saw improvements in quality of life scores, and a very nice trend and durability of these improvements in patients who had stable disease. So this is important because we typically measure response by summing up complete responses and partial responses, and that's kind of the numbers that generally is quoted to show efficacy. But here we are actually seeing significant improvements in quality of life scores, also in patients who have stable disease, meaning that in terms of the clinical benefit for patients in quality of life, that can be achieved even without achieving an objective response, measurable response. So patients who do not achieve a complete response, they may still benefit from lacutamab. From the standpoint of the managing sort of quality of life issues and symptoms in patients with CTCL is very challenging. It requires a team. I want to say something about that. We have a multidisciplinary clinic at Thomas Jefferson University, which is combined between medical oncology, radiation oncology, and dermatology. And we have nurses who are trained specifically to work with our patients in managing symptoms, which is something that requires continuous attention. So this is a high maintenance sort of patient population, because they require significant attention frequently, because they have symptoms all the time, particularly at the beginning of their treatment. With treatment, often they improve, but at the beginning is really challenging, and they require a lot of attention. So, there are some measures that that nursing staff and physicians can implement for the management of itch. As I mentioned, skin-directed therapy, moisturizing, antihistamines, a lot of additional pharmacological intervention that can be used to temper the severity, particularly of the itch. But none of these interventions by itself is a game changer. And at the end of the day, the only thing that really sort of can make a difference is an effective therapy. And the Tellomak trial with lacutamab clearly shows, as the data we presented on Sunday, that it achieves those important quality of life endpoints.